As you know, in November of 2021, the Alabama Department of Public Health was notified of a number of children. Actually, the number resulted in 9 cases, which is considered to be a cluster of hepatitis, again, in children less than 10 years of age. Now, these children were actually from across the state of Alabama, and they presented with varying levels of abnormality of their liver functions. Again, these children were ill enough to come to the attention of Children's Hospital, and we appreciate the collaboration with this particular situation. At this time, and based upon this cluster of cases, we want to remind people that we've not had any indication that these children had COVID disease, nor did they have COVID vaccine. Now, these children did progress to having some more severe illness. 2 of the 9 children did progress to liver transplant. The other 7, it is my understanding that they have recovered nicely. Important message that the Alabama Department of Public Health wants parents and clinicians to be aware of is that, this was a small cluster of children. We do not have any common link in terms of where they are in the state of Alabama, and that these children did all test positive for a fairly common virus called Adenovirus, and 5 of the 9 children subsequently tested positive for Adenovirus 41. Now, we know that Adenovirus 41 is very uncommon to cause liver injury, and again, has only been reported in children that are severely immunosuppressed. So again, this is an unusual cluster. And as part of our investigation in coordination with the Centers for Disease Control, we sent out a health alert network to our physicians and clinicians in the state of Alabama in February of 2022. Again, looking for any additional cases. We have not had any additional cases other than the 9 original at this point in time. But again, given some information that has been coming from the physicians in England, Scotland, and some other countries in Europe, the Alabama Department of Public Health has coordinated with CDC to reissue our health alert network in our state, recognizing that there, again, appear to be some potentially similar cases in other parts of the world. Again, we have no linkage to those cases, and this may not turn out to be a linkage. The CDC issued a health alert network yesterday, and again, Alabama Department of Public Health reissued our health alert network at that time. So my message to parents as a pediatrician is that at this time, this is a very rare finding that we are seeing. We're very grateful that these children are doing well. We do want parents to be aware of the health status of their children, and should your child become ill and you have concerns about your child's illness, call your pediatrician and talk to your pediatrician. But as far as doing a routine screening or any routine testing for this particular situation in children, that is not something that we're recommending at this time, but rather just to have people aware of this. And should children present to their physician with symptoms that are compatible with this illness, again, not only the gastrointestinal and or respiratory symptoms, but also symptoms of liver abnormality, then these children should be evaluated and followed up. So again, our message right now is we are investigating, we are coordinating with the CDC, we are coordinating with our partners at Children's Hospital. We also have notified the University of South Alabama, Women's and Children's at this time. They have not had any cases. Hannah, thank you for letting me remark on this.
Thank you, Dr. Landers. Dr. Buckfellner, would you like to share your opening remarks?
Sure. Thanks, Dr. Landers, for that excellent introduction and summary of the situation. My name is Marcus Buckfellner. I'm a pediatric infectious disease doctor here at University of Alabama at Birmingham and Children's of Alabama. And my role in this is mainly to consult on some of these patients along with Dr. Shao and assist in management of the patients while they were admitted to the hospital, as well as serving as the primary bridge of communication for the CDC and the health department in getting specimens sent to the different labs for sequencing and better identification of the adenovirus to determine it was adenovirus 41. So as we've been seeing more and more of these cases since the fall, I've been the main liaison for the infectious diseases division and investigating this further.
Thank you. Dr. Shao, do you have any opening remarks?
Thank you, and thanks for everyone being on this call. So my name is Dr. Shao. I am a trained pediatric gastroenterologist who specializes in liver disease and liver transplant. And I agree with everything that Dr. Landers and Dr. Buckfelder have commented on. And one thing I'd like to emphasize is that, adenovirus is a known cause of hepatitis, meaning that we know that it can affect the liver. But what was surprising about this specific cluster was the frequency and the severity of their presentation. And just to add on to Dr. Landers' point, I think the biggest emphasis of this meeting and this call is to just allow for awareness of this cluster and to educate the public about signs of liver disease. And in particular, two things that we generally look at as pediatric hepatologists are signs of jaundice, meaning yellowing of the skin, or scleral icterus, which is yellowing of the eyes. And a majority of these patients who presented had one or the other of either yellowing of the eyes or skin in conjunction with their vomiting and diarrhea and subjective fever. And so I think that's a point of emphasis that I want to make to the public is those two things in particular are what we look at in terms of outward signs of liver disease, because otherwise, vomiting and diarrhea are very common symptoms that can occur in a variety of different illnesses that affect children. And so again, if there are any cases of, again, yellowing of the eyes or skin, I would recommend parents immediately talk to their pediatricians. And if pediatricians have any concerns about these patients, please reach out to our division here at Children's and at UAB.
Thank you so much. All right, we will move into taking questions from the media. You can either drop your questions into the chat or use the reaction function to raise your hand to ask your question. We will start with Chastity Maxey, if you'd like to unmute and ask your question.
Good morning. Thank you so much for doing this today. My questions are, you've kind of talked about the symptoms already, but can you talk more about the symptoms, and also are there ways to prevent this? I know that this is a very rare case situation right now, but are there things, steps that parents can take right now to maybe lessen their fears that their children will contract this?
I can take this. So, in terms of preventing this virus, it's really just normal precautions with any sort of viral illness, making sure one washes their hands, staying away from others who are ill. That this is something that can be transmitted by contact, and so just practicing normal precautions with hygiene is what I would recommend.
Thank you. Dr. Buckfelder, Dr. Landers, do you have anything to add?
I think just the emphasis that Dr. Chow made about, again, general hygiene, and this is what we tell parents all the time, wash your kids' hands, make sure they wash their hands before they eat or drink, make sure washing hands when kids are out petting animals and playing in the yard and all those kinds of things that children just normally do. I mean, we obviously have been emphasizing this type of hygiene in our fight against COVID. And so I would just say those same general parameters for parents to be protecting their children's health by carrying out these day-to-day activities.
All right, thank you. Our next question is from Amy Yerkinen with AL.com. When was the last case in the cluster? Do you think that there could be more cases that have gone undiagnosed?
Amy, I'll start out with that, and then my colleagues can certainly comment on this from Children's. The last case that the Alabama Department of Public Health has had reported, we've not had any additional cases since our call for cases in February of 2022. Now, we have looked into some reports. Again, our call for cases did yield 5 more reports to us of children with some symptoms, but none of those children had the symptom complex that we're talking about here. None of those children met the criteria that we are talking about. So we've not had an additional case in Alabama, especially. I think that's important since our call for cases. But again, we have reissued our Health Alert Network, as has CDC, so that clinicians who are concerned about this can go into our system and report this through our red cap, and we will review any reports that we have. It's very likely that we may go back and look at some additional hospital records. But again, at this point in time, our colleagues at the major children's hospitals here in Alabama have not reported any additional cases to us. Thank you.
All right, Dr. Buckfellner, Dr. Shaw, anything to add? No. Okay. I think Dr. Shaw kind of explained liver disease and liver failure and what that looks like. Can we talk about kind of the adenovirus? What are the symptoms of that? Just typically so that parents can be on the lookout if their kids might contract this virus.
Yeah, so, again, adenovirus, there's a variety of symptoms that you can develop from just general adenovirus disease. And so the more common ones are generally gastrointestinal symptoms like diarrhea, some vomiting. You can also have respiratory components with, mild cough and congestion. There are certainly cases where it affects your eyes. So you can have some conjunctivitis. And so those are generally the symptoms that one develops from adenovirus. Again, in terms of the liver, while it's rare, it happens. In general, liver disease, unless it gets severe, you can't actually see it outwardly. And so really it's more of a laboratory test. When it gets to the point of a child being jaundiced or having yellow eyes, then at that point I would suggest, again, reaching out to us here at Children's for further evaluation. I don't know if Dr. Buckfellner has anything from his ID perspective to add on this.
Thanks, Dr. Shao. Yeah, I would echo a lot of what Dr. Shao said. In general, there are a lot of different subtypes of adenovirus. In our case cluster, 5 of our 9 patients had adenovirus 41, which is a adenovirus strain that has been known to cause gastrointestinal disease, most specifically diarrhea and vomiting. And it is adenoviruses in general are a very common cause of fever, conjunctivitis, which is the red eyes Dr. Shao was talking about, as well as vomiting and diarrhea. But it is adenovirus 41 in specific has not really been shown to cause severe hepatitis and liver failure outside of a few case reports done in immunocompromised individuals, but not necessarily in healthy children. So that's really the unusual part of this.
Right, thank you. There seems to be a number of stomach bugs kind of going around right now. I know we mentioned that gastrointestinal issues can be a sign or symptom. What would you say for parents to kind of decipher, when is a good time to contact a pediatrician? When should they take them in? What are those signs, especially if it gets so severe that they need to come maybe to Children's Hospital?
I think, again, in terms of, if a child develops diarrhea or vomiting, making sure they keep well hydrated, making sure that they can drink. And if there's any concerns from that standpoint, I think the parents should certainly reach out to their pediatricians. But again, I wanted to emphasize, in terms of outward signs of liver disease, yellowing of the eyes and yellowing of the skin, again, are two of the main symptoms for me as a pediatric hepatologist that I look out for. But again, with any concerns in terms of hydration, I think that's an appropriate time to reach out to a child's pediatrician.
All right, thank you. It looks like we have a question from Jake Chapman. Jake, would you like to unmute and ask your question?
Sure. I noticed when you guys were starting this, in your opening comments, the point of this was to bring awareness to the situation. Just how vital is it to bring awareness to any sort of liver disease, especially when it comes to children, not only children, but adults, because if you go untreated, how bad can it really get?
That's a great question. The degree of injury that we've noticed in this cluster has been quite large in its range. Again, as Dr. Landers pointed out in her opening statements, two have gotten to the point where they've required liver transplantation. However, the spectrum has been quite wide, meaning that some children honestly were just admitted for vomiting and diarrhea, and then we noted that their liver enzymes were quite elevated, and that's what got us down into our evaluation of what's going on in these children. And so it is important to understand what's happening, particularly, again, given the frequency of how close these children came together and how similar their symptoms were, is what really piqued our interest in the first place, and what got Dr. Buck-Fellner and Dr. Landers and all of us involved with the CDC. And so I think it is important to understand what's happening. I want to emphasize that, again, this is a small cluster. And so I think there's a lot of work to be done. I'm sure there may be some other children that may present, and we'll hopefully learn more about how this is specifically affecting the liver.
Can I have a quick follow-up with that real quick? When you talk about the transplant aspect of it, I think would it be fair to say when it comes to the transplant aspect, sometimes it doesn't happen overnight. It can take time to get that. And when time goes by, the worse it can be for the patient.
Sure. I mean, there's a variety of reasons why someone would go to transplant, but the main reason is what we call acute liver failure. Now, acute liver failure is on, the severe side of the spectrum, meaning that these children, their function of their liver overall has diminished. And this can lead to a variety of different issues that sometimes can't be solely treated with medical therapy and leads to liver transplantation. And so, I would emphasize, again, if children out there are presenting with this conglomerate of symptoms, it is important for them to be evaluated by us, particularly with the yellow eyes and the yellow skin, because cases of fulminant hepatic failure can progress quite quickly, and so it is important for them to be in a large quaternary center where they can be seen by multiple subspecialists in order to better take care of them.
Thank you. Speaking a little bit about how you talked about how these cases were very similar to each other and it kind of piqued y'all's interest. Dr. Buck-Fellner, can you walk us through, what led you to start screening and kind of discovering this adenovirus 41 strain connection between the patients?
Well, all of the children that we saw here at Children's had blood testing for adenovirus initially that was positive. So as part of Dr. Xiao's initial workup for acute hepatitis, the testing was sent to our virology lab for adenovirus. And then from there, we were able to notice a pattern after we kept seeing similar presentations of children coming in with similar stories of fever, jaundice, maybe vomiting or diarrhea. And clinical signs of hepatitis and then went on to have positive adenovirus testing in the bloodstream. So when we noticed that there was a pattern there, we were able to quickly get a group of individuals together with the local health department here, with Dr. Lander's team, as well as the CDC, to see if there was a potential link or association between this that had not previously been described. So from there, we were able to get more information about the specific adenovirus we were dealing with and notice that there was a pattern that adenovirus 41 seems to be a common link between some of the children that we were seeing with this.
Thank you. Now, is the specific strain, is that kind of a common strain of adenovirus, or is it more on the rare side?
So adenovirus 41 is common enough that it's passed from child to child and causes symptoms of viral gastroenteritis, so vomiting and diarrhea, as has been said. It's tough to evaluate the specific incidence of adenovirus 41 because oftentimes the illness that children and adults get tends to be what we would call self-limited, which means they just kind of get better without specific therapy and with good hydration, and then the infection resolves. And so oftentimes we don't do this level of testing on healthy children. We found this link by investigating further because of the severity of illness of some of these children that we saw. So it can be a difficult question to answer. I don't know if Dr. Shao or Dr. Landers has anything else to add on that.
I think from the standpoint of the epidemiology here, we have to remember that adenoviruses are common viruses, and at least 50 or so strains of adenoviruses. And what we know about 41, again, is in general, we don't see this pattern. But again, everyone that has an adenovirus infection is not necessarily tested for adenovirus because, as Dr. Buckfellner said, it's a self-limited illness. And again, having been a pediatrician for a number of years, I've seen a lot of kids with, gastrointestinal illnesses that resolved in a couple of days. So again, in the absence of more severe progression, in the absence of the signs of potential liver problems such as jaundice or scleral icterus, or again just the child becoming more severely ill, we don't test these children because these children will otherwise recover. And I think it's also important to emphasize something that we talked about earlier, and that is with this particular cluster of children, we don't have a common link from the standpoint of where they lived in the state of Alabama or whether they were together in the state of Alabama at some point. Again, we have no common epidemiology for these children. The only commonality we have seen so far is the 5 of these 9 children testing positive for 41, and then the other children testing positive for adenovirus. So I think it's very, very early for us to speculate on anything else, but just to reassure parents that, again, in the absence of worsening symptomatology of illness, if your child has vomiting and diarrhea for a day or so when they're running around the house and otherwise drinking fluids and not appearing to be dehydrated and not appearing to be ill, then you can speak with your pediatrician or your family care provider and discuss your child, but you don't necessarily need to come in and get tested. Because this illness may be self-limited. There are many other viruses out there causing this. We're seeing a lot of norovirus right now that's just causing gastrointestinal symptoms in children. And again, not an uncommon time of year to see that. Thank you.
Thank you. Kind of following up, another question from Amy Yerkinen. Are there any theories as to why this common virus could be causing hepatitis in healthy children when it hasn't done so in the past?
I think that's the $1 million question. It's difficult to speculate why this has happened. At first we thought, maybe this is just chance. It still could be, but just with the frequency again of how close these cases came together, it's difficult to say why this happened. And I'm sure there's many theories that all of us have in our heads that we have very little proof of or evidence for. But from my standpoint, I can't tell you why this is all of a sudden become an issue.
Just to follow up to that, I think the importance here is that while we do not know we are certainly engaging in a significant effort to add to the body of knowledge here, with infectious disease and with hepatology. And again, our coordination with the Alabama Department of Public Health early on, with our partners at Children's Hospital and with the CDC. So, we still don't know. This is still a small group, but it is important for us to do all we can from the investigative and epidemiology standpoint to determine if this is something that is more common than we have seen, or is this something that we potentially will need to be more aware of in the future. Thank you.
Dr. Buck-Fellner, do you have anything to add?
I would just say that question hits the nail on the head as to why Dr. Shao and I have been so interested in investigating this and looking more into it, because as of right now, we don't really know the answer, and we don't know, circling back around to a previous question that was asked about if there are cases out there that we may not have found of hepatitis related to adenovirus 41. I think the reason for our investigation is to bring awareness to other clinicians, both in the state of Alabama and across the country now, with the most recent CDC Health Alert Network that came out, is bringing awareness to clinicians to think about this and testing for this if they previously had not.
Thank you. Now, for the 9 cases that we saw, can you talk a little bit about how they were treated? And I know that we discussed that they all had varying degrees of illness, but some of those really kind of common signs that all of them presented with.
So in terms of how these patients were treated, in general, in the setting of hepatitis without liver dysfunction, it's really supportive care. And, our role as pediatric liver doctors is to first try to understand what the cause of hepatitis is. And if we have a cause, then either we have treatments for it based on the severity, or if it's not as severe and it appears to be improving, then we just treat with supportive care. Now, obviously, in the more severe cases that we had, there are antiviral medications that can be administered for adenovirus. But again, from a liver standpoint, if things progress or worsen, we have a variety of management strategies that we can perform, including liver transplant if fulminant hepatic failure does not spontaneously or does not resolve with supportive care.